Connecting. I started recording. Bye. Welcome, everyone. We are going to wait 2 minutes for people to join the call. So in 2 minutes, we will start the presentation. So a warm welcome to everyone who has joined. My name is Zainab Naimi, and I work at the Department of Maternal, Newborn, Child, and Adolescent Health in WHO headquarters, Geneva. Before we proceed with the webinar, we have some house rules that are also available at the top of the chat window. I will repeat these for everyone's reminder. So just so everyone is clear, we are all muted on entry, and we only unmute speakers when it's their turn. We will have a question and answer session after the presentation. So please post your question in the chat room and send them to all participants during the presentation. So you don't have to wait until the presentation is over. And if it's not possible to send to all then you send to all panelists. My colleague, Benedict Walter, she will note down all the questions and read them out loud in the question and answer part of the webinar that she will be moderating. Any questions that we don't have time to answer today will be shared with our speakers for today's webinar and will be answered on the website in the following days. As you know, the Network for Improving Quality of Care for Maternal, Newborn, and Child Health has been organizing a series of webinars on selected topics on quality of care from a country perspective and on quality improvement implementation science. You will remember that last year we had 2 webinar series. The first one was about point of care quality improvement, where we looked at quality improvement at the facility. The second series looked at very specific examples of quality improvement work from the countries that are leading the quality of care network. There was also a special collaboration with the Global Health Laboratory for Quality UHC on how quality of care for mothers, newborn, and children serve as a pathfinder for enhanced quality of service delivery. We had a short break over the winter holidays, and I'm now excited to welcome you back today for a webinar on cleaner hospitals for better quality of care, the example of Ethiopia's Clean and Safe Health Facility Initiative, also called CASH. This is the first of 2 webinars that will explore the linkages with WASH using specific country examples. Our speakers today are Mola Godis and Tevodros Fantahun, who will present Ethiopia's CASH initiative. This is a program of the Ethiopian Federal Ministry of Health to make healthcare facilities clean, safe, and comfortable to patients, visitors, and staff. CASH is designed to improve the attitude of staff and other stakeholders towards cleanliness with the end goal of improving quality of care. It puts a special emphasis on hospital infection prevention and patient safety standards. The program started in 2015 and is now implemented in all public hospitals in Ethiopia. Mola Gadis is the Infection Prevention and Patient Safety and CASH Coordinator at the Ministry of Health. He has been working at different levels and positions as a public health professional and has managed many public health outbreaks and epidemics over the last 10 years. Mola Godis holds a degree in both environmental health and public health with a specialty in biostatistics and health informatics. Our second speaker, Tedros Fantahun, is working at St. Paul's Hospital Millennium Medical College as the head of quality management department. He's the focal person for the CASH initiative and member of the Infection Prevention Committee. He lectures at the Department of Public Health, and he is also a national resource person and consultant for infection prevention and patient safety. Tedros Fantahun holds degrees in both environmental and public health and holds a diploma in infection control. I will give the floor now to our first speaker, Mola Godis, to give us an overview of the CASH initiative. Mola, the floor is yours.
Okay, Vedi, you on mute. Your whole team is on mute. You need to unmute yourself. Okay.
Okay. Hello.
Yes, we hear you.
Okay. Thank you, Zainab. And first of all, I would like to thank for WHO headquarters colleagues for organizing this webinar on the experience of CASH in Ethiopia. To start the sharing of Ethiopian experience on clean and safer healthcare facility initiative or CASH, I think it's better to start from the overall the health sector transformation plan of Ethiopia. You know, Ethiopia has been working a lot to improve the health of the population in overall, and as part of this health sector transformation plan of the health has been implementing since 2015. And this consists four transformational agendas or pillars, and among these improving quality and equity of health services in all healthcare facilities, the one and which is the core component of this strategic plan or transformation plan. At the same time, Ethiopia has identified top priorities of targets that are supposed to be achieved within this transformation plan. That means reduction of maternal mortality care, reduction of neonatal care, child care, and infant mortality are expected to be achieved at the end of this strategic plan. So these strategic plans consists four transformational agendas and top priorities, especially reduction of maternal and child mortality, infant as well as neonatal mortality rates. For us to achieve and address the above strategic plan as well as the targets that are set out to be achieved at the end of this strategic plan, there are so many initiatives, strategic initiatives that have been implementing since 2015. Among these, clean and safe healthcare facility or CASH initiative is the one, and which is boldly mentioned as government priority at national level, at regional state health bureaus, as well as at hospitals and all healthcare facilities. So when we design the initiative, the objective is just to create a safer healthcare environment or hospital to patients, clients, as well as staff, especially with special focus on maternal and child health reductions. Therefore, we have the principle here. Cleaner hospital is safer care. The safer care is about quality of care, and this leads to improve the maternal and child health, or that leads and contributes to the reduction of maternal and child mortality, as well as infant mortality and neonatal mortality. Therefore, the logic is that if we don't have a clean and safe hospital, we cannot provide or we cannot ensure safety of the clients or patients, as well as if we are not ensuring safety of the healthcare service, we cannot provide quality of care, so that we cannot as well reduce the maternal and child mortality that are set out as a national target priority areas. Therefore, this is the principle of CASH, and it is as one component of quality of care nationally as well as at healthcare facilities. Therefore, currently, the initiative is in a good progress and bringing a successful achievements due to some basic reasons. The one is that initially we try to mobilize and advocate the initiative starting from government officials, including politicians as well as parliament members at all levels, at national level, at regional level, as well as at healthcare facility level. So this is a basic driving force or factor that causes us to improve the hospital's cleanliness and safety. At the same time, there is also good commitment at all levels because already the Ministry of Health has identified target areas that should be achieved due to the implement of the health sector transformation plan. Therefore, so as to address these core components or issues, strategy initiatives are very critical and very, very important. Therefore, clean and safe healthcare facilities already initiated and designed by the Ministry of Health, so that all healthcare facilities, especially hospitals, have been implementing this initiative as a first priority at all levels. Similarly, in addition to that political commitment and advocacy at healthcare facilities or hospitals, there are also community engagements, staff engagements, and the hospital as well as all staff's engagement. So these are the key factors that the initiative is in a good progress at this time. Yes, of course, here there are some challenges, especially, cash, clean and safe healthcare facilities is a very big component. It consists about wash components, water, sanitation, and hygiene. It consists about infection prevention and patient safety components. It also consists about facility management. It is a very, very huge initiative, and it needs a lot of or huge investment here, especially budget is one of the challenge for the this initiative. So that's to generalize about the cash clean and safe healthcare facility. Currently, it has been implementing as a big component of the quality initiative. It's considered as a quality initiative. Already, as I said you, the objective is to create safer healthcare environments. That is ultimately just to contribute and to reduce maternal mortality, child mortality, neonatal mortality, infant mortality that are already identified by the health sector transformation plan at the end of 2020. So this is all about cash at a national level and throughout the country. Maybe if there are some additional questions, still I can entertain here. I think it's better to proceed to the hospital experience of cash from Tedros. Thank you.
Okay. So, thank you, Molla. And
are you launching the presentation, Theodore?
yeah, I'm launching it. And hello to you, everybody. I'm Theodros, and I'm going to present you the case of St. Paul Hospital, Millennium Medical College, on implementing cash initiative. So, is it visible, Arabella?
Yeah, it's perfect.
So you can see it, okay. So let me start. As I said, I'm going to present you the case of St. Paul Hospital in implementing cash initiative. So Molla has gave you a brief background about the implementation of cash at national level. So my presentation will focus on the institutional level, which is St. Paul Hospital, which was selected and recognized by the Ministry of Health as best performer on implementing cash in the nation. So I'll present it about. So this is my outline. I'll first discuss about the background of St. Paul Hospital, and then I'll discuss about cash and implementation of cash, successes, enabling factors, challenges, and the way forward will be followed. So say something about St. Paul Hospital. It was established by Emperor Haile Selassie, which was the king of Ethiopia by the time of 1968, and it's became a college by 2010 recently, and the college has more than 2,800 clinical and academic and administrative staff. It provides medical specialty services to patients from all over the country. It is tertiary hospital. So it is also the only national kidney transplant center in the nation, and it has a capacity of total 700 inpatient beds. At the current status, actually, we are expanding our services to different other services. So in the near future, this capacity will be doubled, I think, in 2 or 3 years of time. And it has it's managed an average of 1,200 emergency and outpatient clients daily, and it conducts an average more than 900 deliveries per month. So this is about St. Paul, and I will try to say something about the background of CASH. As Mollab stated earlier, the CASH initiative is launched nationally, and institutions have been implementing it at the institutional level. So at St. Paul, we have our goal of implementing CASH was to make St. Paul Hospital Millennium Medical College safer place for everyone in it. Which means the patients, primarily healthcare workers, visitors, students, as it is a college, and everyone in it present at St. Paul Hospital. So it was launched at 2015 with a motto: "Clean care is safer care," and we have adopted the national CASH and infection prevention and patient safety standards and audit tool set by the Ministry of Health. We have established CASH committee at the institutional level at St. Paul, which was in line with the national CASH policy recommendations. And we have developed CASH policy in terms of reference. We have conducted baseline assessments using CASH audit tool, and we have developed an action plan based on the findings of the baseline assessment. And also we have assigned CASH ambassador, which we thought could help us to advocate our CASH initiative implementation. And we have integrated CASH initiative into the hospital strategic plan. So this is the structure of CASH initiative in our college. So the initiative is overseen by the Federal Ministry of Health, and at the facility level, it's overseen by the hospital management. And CASH team is established to monitor CASH initiative activities, which is supported by external stakeholders like clients. And it is supported also by the college infection prevention and patient safety department, and these activities goes down to service directorates, CASH initiative activities, and then to department and service units. So in implementing CASH, our strategy was focused on firstly on improving the attitude and the skills of healthcare workers, because cleanliness is more about attitude than practice. It is on the attitude, so change comes on the attitude of healthcare workers. So we focused on the attitude and skills, improving the attitude and the skills of healthcare workers. So we provided training on infection prevention and patient safety and CASH for about 417 staffs, healthcare professionals and support staff in our college. And we conduct cleaning campaign every quarter, which is being led by the college vice provost for medical service and our CASH ambassador. Our CASH ambassador is a celebrity, which is famous in our country, as I said, which could we assume could help us on improving or promoting our CASH activities. So he is presented at the campaign every quarter, and we conduct the campaign with the healthcare, with the employees of St. Paul Hospital together. So the other activities, we follow up healthcare workers' activities after we have provided the training, and the other activities that we do to improve or to change the attitude of healthcare workers on cleanliness is competing wards and service units among each other, by which cash is the mainly focus area. So departments are evaluated by sort of criteria, cash criteria, on the level of cleanliness of their departments. So at the end of each month, departments will be evaluated by that tool and awarded accordingly. So we thought this could improve the attitude of healthcare workers. The other is we have developed a audit tool, cash audit tool, and we provided to the departments so that they can evaluate themselves instead of waiting some other party or some other one to tell them their gaps. So they will evaluate themselves by this audit tool, and they will improve the gaps they have identified by their own. So on top of that, the cash committee and cash local person regularly monitors the department's implementation of cash initiative. So this is to show you some of the things that I have said. And on the left top of your screen is watching a training session while we provide cash initiative, infection prevention and patient safety training. And under it, you're watching a picture of that we were conducting cash cleaning campaign. And at the middle of the picture, the man standing with mop you're watching is our cash ambassador. His name is Master Balacho Burma. He's World Laughter Master, and he's a Guinness record holder. So he's a celebrity, and he's our cash ambassador. And the right side of on your screen, you're seeing a trophy, which is awarded for the departments based on their implementation of cash or the progress of the progress they have made. So this is awarded to each the winning department based on, as I told you, the cash audit score. So this is to show you some of the activities in picture. The other strategy was to engage patient and community in implementing cash initiatives. So we collect feedback from patients every time, from suggestion box, from community forums and others, on our improvement of on cleanliness and their concern or their role or engaging them on implementing cash initiative. So the other activity that we are doing is advocating cash initiatives through radio programs, which is widely heard or famous channel in the country, Pana Broadcasting Corporate. We have both airtime from this channel, and we broadcast our activities. So we advocate our activities through that channel. And the other is Ministry of Health. There is a Ministry of Health TV program which is aired once a week, and we also promote our activities. So the other activity we have conducted to engage our patients is on the cash implementation is assigning ward ambassadors at each ward. So at the beginning of each week, one patient will be assigned at the ward to monitor the cleanliness of that ward or that room the patient are admitted. So if there is any problem related to cleanliness and safety, that's what the ambassador patient will communicate with the department or the patient ward nurses or directors, and the problem will be solved accordingly. The other is we provide health education on cash and IPPS on the daily basis, and we distribute leaflets and similar things to the patients. The other strategy was to improve the infrastructure. Accordingly, we have improved 3,000 meter square area designed for green area, and we have constructed and renovated different hand washing facilities like washing facilities like hand wash and showers, and we made water availability continuous 24/7, and we regularly inspect the quality of water from different water sources at the college. And we also have constructed alternative water source in the college, which is groundwater built for consumption. And the other is by taking feedbacks from patients. One of the concerns of the patients was food safety. So we try to refurnish our food processing unit. We're using standard materials. So the other activities was washing facilities was constructed for families of 6 child admitted to the hospital. As I've mentioned in the early phase of my presentation, our clients are coming from different parts of the nation, and some of them are economically poor. So when they care for when they bring their sick child to the hospital, and they have nowhere else to go, so they stay there in the hospital throughout the time that their child is admitted. So they have no clothes to change or something like that. So they used to wash their clothes on the grounds of the hospital all over the place. So that was one of the anesthetic or one of our concern and the patient's concern. So we constructed washing, instead of prohibiting them to wash their clothes in the hospital, we constructed washing facility for them in the compound, designed a place so that they will not contaminate, or they will not wash their clothes in different parts of the compound in the hospital. The other activity that we conducted in relation to maternal and child health services, we have constructed a placenta pit. These are the activities which are conducted based on which are attributable to CASH initiative. So we constructed placenta pit, which is directly attached to the delivery ward, so to keep the hygiene condition of the college. The other activity was to renovate patient care areas, especially pediatrics ward, neonatal ICU, and which are areas which are related to maternal and child health services were refurnished and were made child-friendly service, maternal-friendly service, like that. So the other activity we done was we made available portable toilets for laboring mothers so that they feel comfortable to give delivery at the facility. So these are to express my statements with picture. And at the left side of your screen is what you seeing is portable latrine for laboring mothers that I have stated. And on the right side of your screen is what you're seeing is the placenta pits that were constructed after CASH initiative. So this is the other fruits of CASH initiative. As you can see, this was made due to CASH initiative. This is the green area that I have stated in early phase of my presentation, the 3,000 meter square green area project. And on the bottom of your screen, the pictures that you are watching, nowadays people are enjoying their stay at the hospital like this. taking fresh air and enjoying in the clean environment. So this is the fruits of cash initiative, as you can see. So the other thing is the refurnishing that I have said, making the service areas child-friendly service, maternal-friendly service. So this is the pediatrics ward that you are seeing, which is painted or with child-friendly pictures. So this is some of the activities. And the other is that this is on the top of your screen is you're seeing washing facility that I've told you before for mothers who care for their sick child. So on the top of your screen, you can see the mother washing clothes on the washing facility. And the other is improvement of the food establishment service or food processing unit. So these are the new machine bought by Cash Initiative. So this is to show you some of our activities. So this is. So when I come to the success of Cash Initiative, overall the major success of Cash Initiative is improving the standards of Cash Initiative, which was set by the Ministry of Health. So as you can see from the graph, each and every standards of the Cash Initiative have shown improvement throughout this time. That means from implementation of Cash at 2015 and the final assessment conducted at 2017. So as you can see, we have achieved 100% on the 3 of the standards, like kitchen appliances and fixtures, laundry service, staff appearance, and most of the standards have shown significant improvement. And we also actually we need to do more to come to full achievements. But as you can see from this graph, this Cash Initiative have brought significant improvement to cleanliness and safety of the hospital. So the other success was to improve patient satisfaction. As we can see from the patient feedback, most of the patients, even though we cannot say it is simply or purely due to Cash Initiative, but we can clearly see that the patient satisfaction has improved due to Cash Initiative. And the other success was to motivate St. Paul Hospital employees, since there is recognition and award system on implementing Cash Initiative. And we have won the national cash competition between the hospitals in the country twice by implementing Cash Initiative successfully, by being exemplary. And the other, due to this, we have there is an alliance called Ethiopian Hospital Alliance for Quality in the country, and we are among the 2 clusters. There are 2 clusters in the Addis Ababa, the capital city of Ethiopia, and among the 11 hospitals present in Addis Ababa, we are leading one of the clusters due to our achievement in Cash. So this is the recognition we got from the Ministry of Health on successfully implementing Cash. And when we come to the enabling factors, the most significant enabling factor, I think, is the leadership commitment at the national and at the institutional level. So Cash Initiative, as my colleague stated earlier, is led by the top official government officials. Like it was during the implementation, the Cash Initiative was led by the Deputy Prime Minister of Ethiopia. So you can see how significantly given recognition for Cash. The other is the role of Ministry of Health in implementing Cash. It provides training throughout the country, regular monitoring, support, material, and technical support. So Ministry of Health has, I think, played an important role in enabling us to implement Cash Initiative. The other is client community engagement. Like as I've said earlier, we have one of the success factor for our successful implementation of Cash is our willingness to engage, or our activity to engage patients in community, like being as a ward ambassador, and we integrating their feedbacks to our activities. And the other is to engage our public figures, like as I've told you before, our cash ambassador is his public figure, and he's well known, so our activities were being advocated by him. So these are some of the enabling factors. When I come to the challenges, as I've initially said, cash or cleanliness is more of related with attitude, healthcare workers' attitude. So I think we need still to do more on improving attitudes of healthcare professionals and healthcare workers. And the other is, as we are on the phase of transforming our college, there are currently so many construction the college, so it is being like we cannot fully achieve. Well, this is one of the reasons that we cannot fully achieve the cash standards. The other is resource constraint, as it is clearly known. We are resource limited country, so there are some resource issues to meet the standards. These are the minimum standards, by the way, that I showed you earlier. So to improve our health facilities, to make them clean and safe, we need standard materials, we need standard facilities, so they are resource constraints. And there is also lack of benchmarking opportunities. As I've said earlier, we won actually the competition nationwide, but since we are the best performing hospital in the country, we cannot benchmark other facilities better than us. So we like to have a benchmarking opportunities which is better health facility than ours. So the way forward is we are planning to work more on attitudes toward cash among health care professionals and support staff, overall the health care workers. And we plan to continue implementing cash by integrating with wash fit, which is currently being worked on by the Ministry of Health and WHO. So we are aiming to implement that facility-based wash tool or facility. And the other is to empower other health facilities under St. Paul Hospital Millennium Medical Cluster on cash activities that, as I've told you before, we are leading one of the cluster in the city, and under our hospital there are several health facilities which need our support. So we aim to empower them on implementing cash initiatives accordingly. And the other is benchmarking, as I've said. And finally, these all cash initiative activities are being implemented by integrating with the hospital's regular activities. So we are thinking to allocate specific budget for cash initiative. So and also to find other partners to support our cash implementation activity. So cleaning matters. This is by the way, this picture is our temporary waste storage site, which is designed by our cash team. So this is all about our facility, our St. Paul Hospital Medical College cash implementation activities. Thank you for listening.
Thank you both, Mola, for giving us the big picture at national level, and Theodoros for really diving into what's happening at St. Paul's Hospital and the impact on infrastructure, attitude, client satisfaction. We have a few questions for you, so I'm going to read them out. Please, for both of you, I think. Answer them. If we don't have the time to answer them all today, people on the call, all these questions and the written answer from Mola and Theodros will be posted on the website together with a presentation and a document that is going through WASH and cash in particular in Ethiopia and the impact on universal healthcare. So first question for you both. This is a question from Kerstin Boom, who is asking you, when you mentioned the competition, how you won the cash competition twice. How did you do the competition between the hospital and how did you determine the winner? Did you hear that?
Yeah. Yes,
okay.
Yes. Okay. Thank you. Hello.
Hello.
Yeah. I am Mola. You know, there are two types of competition. The one is there is at national level, and the second is at facility level. Even there are also additional competition systems or practices or mechanisms at regional state level. So at national level, we have a national cash audit tool. Based on the national cash audit tool, we conduct an assessment among all healthcare facilities, especially hospitals. Therefore, those hospitals which perform a good result in cash are awarded, and similarly at healthcare facilities between departments or unit services are competing to each other. So based on these two things, those hospitals which perform well are recognized. Maybe Theodros can add here.
So just to add on our colleague, my colleague Mola, at St. Paul level, we compete departments each other by using standard tools, which is focused on cash cleanliness and safety. So departments are given these tools to evaluate themselves and to improve their performance related to this standard. So at the end of each month, this cash committee team will evaluate them using this similar tool and gives the score by depending on the status of meeting this standard. So departments compete each other by the similar tool, and the department who scores higher will be awarded a trophy that I have shown you earlier. And if the department wins 3 times that trophy or the competition, the college, the hospital will provide bonuses for the health professional working at the department. So that is one of the motivating factors for implementing cash. And at the national level, as Molla stated, there is a competition, national competition, with hospitals on implementing cash, and this is evaluated by the national audit tool, cash audit tool. So we have competed with other hospitals in the country, and we have been selected by the ministry to implement the cash initiative successfully. So we won it twice, and we, of course, have got some funds, some money from the ministry on our achievement of cash. Thank you.
Thank you. Thank you very much, Mola and Tedros. You just answered one of the other questions about reward, whether there was other reward. You have a few questions about monitoring, which is which tools do you use for monitoring, which elaborates a bit of what you just said, but also whether these tools or checklists that you used could be shared. And people particularly refer to the graph you displayed against how much you have achieved against the cash objective. So monitoring tools and whether it can be shared.
Yeah, this is Theodros, and to answer, we can share the tools. So the cash audit tools for anyone interested, since the purpose of this webinar is to share our experiences, and we are happy to share for anyone interested.
Okay. There's a specific question from Susan Cross about the role of cleaning staff, which she mentioned is often poorly represented or considered a marginalized group, despite what they can do for infection prevention and control. How has the CASH initiative targeted cleaning staff, their training, their skills, their role, and was there anything that came out from their engagement in the process?
So this is again Tedros. At our facility, which is St. Paul Hospital, as I mentioned it on my presentation, we have provided training for healthcare workers, and part of them was cleaners. We have provided infection prevention and patient safety and CASH training for almost 204 cleaners and support staffs. So the first thing was our aim was to improve their knowledge and awareness related to CASH and infection prevention and patient safety. So we provided training for 204 cleaners and support staff, and they were central part of the initiative, I can say, implementing CASH initiative. They communicate directly with the clients, and they are represented at the Infection and Prevention and Patient Safety Committee, which is established to monitor or oversee this CASH initiative. So their concern is addressed by this committee. If there are any concerns or they have any issues, it is addressed by this committee, and most of the activities are communicated with them while implementing CASH initiative. And I think we've engaged cleaners well accordingly, I think.
Thank you, Theodore. One question about what you said about the difficulty, the challenge in changing the attitude of health workers. One person here, Dan Jones, wants to ask what you mean. Do you mean things like they didn't practice hand washing as much, with soap as much as they should have, or what particularly was the difficulty in the attitude?
Yeah, thank you for asking. What I tried to say is, since cleaning is, these activities are conducted at the hospital, and as you know, people's attitude toward this people's or professionals' role at the hospital, most of us or most of the people tend to focus on clinical activities rather than these cleaning activities and something. So while we try to engage healthcare workers like senior physicians, health professionals, most of the professionals tend to ignore this activities or this initiative due to their low attitude towards cleanliness, and they tend more to focus on clinical activities rather than cleanliness. So I think this is well known and universal. I think universal attitude all over. I don't know about other countries, but in our setup, we have this challenge on healthcare professional attitude towards cleanliness, and so that was what I am trying to say. Thank you.
Let me add here some points.
Yes.
You mentioned earlier on the presentation. You know, our primary intention when we designed the initiative is not just to solve the attitude of people, because previously about hospital cleanliness and safety was not considered as a critical component of the healthcare service delivery. It was not considered as a quality component or as quality issue. Therefore, primarily, when the initiative was designed, just to solve the attitude of people. This was our primary objective. Accordingly, currently, there is a good attitude on healthcare facilities as well as hospital managers, because we have done a lot in advocacy. But as Tedros mentioned, that still there are challenges on regarding about the attitude of people. But relatively or comparatively as previously or before the initiative, still there is a good progress and there is a good improvement or change on attitude of people, especially most of the healthcare professionals have a positive attitude towards the hospital's cleanliness and safe. At least they understand that it is very important. It is part of a quality of care. But due to some reasons, and especially on new status and some hospital status, it's a little bit challenge, but not as such a big one. But we cannot say that it's a big challenge, but it contributes as one of the constraints. So this is all about the attitude of the cash on healthcare facilities or hospitals experience. Thank you.
Thank you. I have 4 more questions. I think we can make it. This one is related to behavior change among workers. The cash implementing score that you presented in your presentation seems to be largely based on measure of infrastructure, and hardware. How did you systematically monitor the behavior change in staff workers? In health workers.
Okay. Actually, as I've said, there are output measures, process measures, and outcome measures. Just what we can measure is that the attitude of status. To measure the attitude of status, we conduct qualitative surveys. Just how they are aware about hospital cleanliness safety. How can they relate to cash in terms of quality? How they relate cash is one as component of the improving health service quality, as well as to contribute to reduce maternal mortality, child mortality, infant mortality. So based on these criteria, we conduct a qualitative surveys or assessments to address about the staff's attitude towards the hospital cleanliness and safe or cash initiative. On top of that, we also measure about the outcomes. The outcome of this initiative is just to create a safer healthcare environment. Therefore, based on the audit tool, that is the main reason why we focus on the outcomes. Therefore, if the hospital is becoming now cleaner and safer for clients or patients, so just relatively you can say that there is a good attitude in healthcare professionals, because the main factor, contributing factor for this initiative is the attitude of the status, as well as even including the community, because communities did not have a good awareness towards hospital cleanliness. So, for example, in hospitals previously, most of the healthcare facilities didn't have adequate water supply, didn't have adequate toilet, didn't have good healthcare waste management practice, as well as good infection prevention, patient safety practices. So currently there is a good attitude as well as practice, as we did a lot in advocacy.
Yeah.
So just to add on my last statement, this is Theodros. The way that we monitor the improvement in attitude among healthcare workers is just after providing training on infection prevention and patient safety, we conduct post-training follow-up and observation to monitor the attitude and the practice of healthcare professionals in relation to cash activities. So we conduct observation like hand washing, waste management observations among healthcare workers. So we observe their practice and attitude towards sticking to or adhering to these standards. And the other is by we interview, as Mollab said, we conduct qualitative qualitative surveys, mini surveys like facility level surveys to monitor our improvement on implementing cash initiative. The other is we measure the healthcare workers' change in attitude by their engagement in cash activities like cleaning campaigns.
Okay.
So the more they engage in cleaning campaigns and cleanliness activities means that the more the chance of changes. The more they engage in cash activities, the more they are changing their attitude towards cleanliness and safety, I think.
Thank you. I will take only one final question because these are big questions that require detailed answers. We have a person on the call with Sham, my colleague Sham Syed, who asking if you have a story you can share from a health worker from the Simple Hospital and how cash has affected them, has changed the way they work.
Can you repeat again?
If you have a story from a health worker from Simple and how they were affected by the cash program, and maybe it changed the way they work.
So from St. Paul, I have not that single story, but from overall with related to cash, I can tell you some story, even if it's not at St. Paul.
Yes, please go ahead.
At another health facility, which is located rural area of the country, we have heard there was a wedding ceremony conducted at the compound of the hospital. Due to the attractiveness of the hospital, there was one wedding ceremony conducted, and that was amazing. Since we don't expect weddings to be conducted or held at hospital level, but we assume that this is the fruit of cash initiative, implementing cash initiative. So the green project conducted by that hospital was impressive, so that people have attended their wedding at that hospital. I think it will be a story.
Yes, thank you. Zainab, over to you. Thank you for all your questions. We're going to send the answers online as well for the 2 or 3 we didn't have the time to answer.
Thank you, Mola and Tevros, for sharing such encouraging experiences on what can be achieved through implementing quite complementary strategies for improving quality of care through the CASH initiative. And I think you've indeed demonstrated how clean hospitals can contribute to safer healthcare, and especially how this can impact care provided to mothers and children. Some of the messages I would encourage that we all take with us is also how the initiative didn't only improve patient satisfaction, but also how it improved the satisfaction of staff providing care. So I think that's a very important message for all of us. I think also the strategies applied by CASH shows the importance of not focusing only on the training, but how to sustain those skills among providers. So that's the second thing. And finally, it's encouraging to see how the broad infrastructure work that took place did consider the needs of laboring mothers and children. So taking a holistic approach to the patient population. So this has been very inspiring. Thank you again to our speakers, Mola and Tevros. Thank you for the excellent moderation, Sena, and to all participants for contributing to this interesting discussion. I would like to remind you that the recordings of all webinars can be found online on qualityofcarenetwork.org. And while you stay tuned for the next webinar on WASH, we are working on updating the webinar schedule so you can see what series will be coming up next. And this will, of course, be shared on the network website and at the MCA department website in WHO. So if you find these webinars interesting, please do share with your colleagues so we can have even a broader outreach for these valuable experiences on improving quality of care. And so we can make sure that we continue to learn from each other. And the recordings are available online, so do encourage your colleagues to access them if they were not able to join today. So thank you to everyone, and goodbye.
Thank you.
Thank you.
Thank you.